Attendees are in listen-only mode.
All right, good afternoon again, everyone. Thank you for joining us today for our third meeting of the Rate Review Advisory Group. All of us at the Maryland Department of Health like to extend a warm welcome to the advisory group members as well as members of the public who are present. Can we go to the next slide, please? All right. So here's our agenda for today. In our first meeting, we walked through the general rate buildup. And at our second meeting, we talked in detail about the decision-making process behind each component and how we build up to a fully loaded rate. This meeting, we would like to focus on discussion of data collection that is needed to identify any recommended adjustments to the rehabilitation service components. And we also want to discuss potential FY24 priorities to be analyzed through this rate setting cycle. Can we go to the next slide, please? So just as a reminder, this advisory group is part of a new structure which comes from Secretary Schrader and Deputy Secretary Simon's commitment to the development of adequate and sustainable rates that promote the vision and mission of the DDA community. The commitment members have made to participate ensures an open and transparent process to review rates. We can go to the next slide. Members were sent an email with meeting minutes and March 21st, 2022 meeting clarifications that was distributed on April 8th, and specifically about the inflationary 9.5% adjustment to wages, residential hours policy, and FY22 rate changes. As chair, I will make a motion to approve the minutes. Would a member of the group like to second that? Or are there any discussion of the minutes, any corrections?
Second.
I'll second the motion.
Okay. Great. Then we will call the question, have a vote. All in favor of approving the minutes from last month's meeting?
Aye.
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 And anyone opposed? All right. Thank you, everyone. Now I will turn it over to Leslie from Optimus to share some updates that have happened since our last meeting.
Thanks, Jennifer. So just wanted to update you. In the last meeting, a transportation figure was shared by Chris Parks. We wanted to understand how this amount was being calculated and just really get where the perspective was coming from. So we had a follow-up call. And so during the call, Chris was able to share with us how he arrived at the dollar figure. The meeting was not meant to guide any decision-making or any additional, and no additional follow-up was requested. But with this meeting in mind, we were giving consideration to the need for clarification on the rules of engagement outside of these meetings. So I just want to turn that back over to Jennifer to speak to that.
Sure. So, and we definitely recognize a need to have clear rules of engagement for communication outside of our monthly meetings. So we're going to be working on developing that to include in our governance documents. What we want to do is clarify roles and responsibilities of members, including MDH representatives, and kind of review the practices of the advisory group of the public engagement tool bound by the Maryland Open Meetings Act. So I think the bottom line is that we definitely want everyone to have clear expectations of how communication is going to work in between meetings. So we will work on developing that for our governance documents.
Thanks, Jennifer.
Turn it back over to Leslie.
Thank you. So we'll go on to the next slide. So Just like we talked about in the last meeting, we've identified several strategies on approaching the review of the rehabilitation rates. We talked about revisiting various components within the rate buildup, and based on feedback, transportation has been identified consistently as a component to revisit. The other lever for impacting rehabilitation rates was revisiting the staffing ratio. We wanted to look at the assumed average staffing ratio and determine whether it was appropriate for the operationalization of the service. Sorry. The third option we discussed was to look at potentially creating discrete group sizes to address that fixed versus variable costs concern. So those are the three options we talked through last time and that we've been exploring on how to address these issues in between meetings. In the next few slides, Chris will be walking through what progress has been made on each of these options, and then we'll have a discussion on any of additional feedback for those. Next slide, please. Turning it over to Chris on this slide.
Hi, yeah, thanks, Leslie. My internet is having some issues, so hopefully I come through clearly enough, but please be patient with me while I try to figure that out. So Leslie kind of gave that high-level overview of where we came from, and wanted to walk through some of the detailed updates where we're looking now for each of those specific components that we were, making considerations around. So one of the things we talked about was transportation. Another was the staffing ratio. And so what we had, promised to do last time was to look at collecting data from providers to help inform the rate development and see if any adjustments are warranted and to what degree adjustments would be appropriate. And we asked for feedback. So we shared that, I believe, last week, asked for feedback. And any additional comments on that. And so we did receive some feedback through the Google Forms. We have some opportunity to discuss this in a little bit more detail. In theory, what we had put in place was to finalize the data collection template, and optimistically we had hoped to distribute that to providers by this Friday if there weren't any major changes that were needed. And then we would, anticipate trying to have some sort of relatively tight timeline to collect that information back and be able to share it with you prior to the next RRAG. Based on the feedback that we've seen so far, it seems like it may be the case that additional discussion is warranted and needed around this data collection process. And so I think, this is what we had shared last week. We've gotten feedback since then, and I think those dates are probably not necessarily, appropriate at the moment. I think the intent here is for us to expand that timeline a little bit. I think tentatively at the moment, what we're thinking is to be able to, incorporate feedback that we've received and have some time to respond to that, and aim to provide an update at the next RRAG meeting for data collection. And then from there, once that's kind of been finalized, then data collection could actually start with information from the providers. So those dates on there, don't throw too much weight on those. Those were just kind of placeholders trying to understand. So this is, again, we had seen some feedback, and on the next, on the next slide there, we wanted to start talking about this. And so really giving an opportunity to talk through the various information that was presented in this data request, any questions, comments, thoughts on any of the information that was being requested. And so this is really some time that we wanted to provide for discussion and to hear feedback and responses from the RRAG, or if you've talked to any additional providers or stakeholders about this, any information that you'd like to share about this in consideration of how we would collect data. So with that, I'm just going to open it up here for a little bit. This is what we have for the first part of the template that we had shared, walking through that transportation data request, where we were looking at requesting hours of time that was spent in transportation, as well as non-hour or non-wage time. So things like maybe loan payments, fuel, insurance, maintenance, those kind of costs. These were the pieces that we were aiming to collect. So I'll just open the floor here. If anyone has any questions, comments, thoughts, this would be a good time to discuss.
Chris, it's Chris Parks. I believe I saw in the documentation that we were looking to use first quarter 22, and just want to express concern. I don't think we have a better time period to grab, but there are certainly some issues with respect to the data that's going to be coming out of that first quarter. Still in Appendix K, and middle of the winter, weather issues. Just it's going to need to be analyzed a little bit differently than just a normal quarter of functioning. We haven't had a normal quarter since before COVID.
Yeah, I think that's a great point. And that's some of the feedback we had received through the Google Forms as well, that there is some concern about the timeline here. And so, just being transparent, we're all working towards the same goal of getting these addressed and any updates that are needed. So with that context in mind of, potentially there are issues coming out of first quarter with COVID, things like that. If this is something we want to address in the near future, our thought process was we want to collect kind of more recent or emerging data. It's going to be difficult to look at data that was really, through maybe calendar year 20 and 21 definitely would be heavily impacted by COVID, and we're hoping that this is less impacted as we look more recently. We thought that it may be difficult to get information, or it may not be appropriate to get information that was, several years old. So that's kind of our thought process at the moment, was to try to look at more emerging data. Maybe that's a consideration of looking at, a combination of first quarter and second quarter data, or trying to see if there's certain adjustments that should be made to that data collection. But we just wanted to, collect thoughts there.
Chris, it's Laura. I share Chris Parks's concern. I'm just wondering if there would be a way to collect the data where providers would report, rather than across the whole agency, but to look at, where they are providing transportation, or transportation is, is being addressed more fully for a subset of people they support.
This is Donna Retzloff, and I would have to agree with Laura and Chris both, just knowing we're by no means in full operation, and I really feel, I don't know exactly what the answer is in terms of the time span for the data, but that data is going to be very skewed to what our services would really look like in full operation and the cost.
Hi, this is Karen Lee. We're a DC fee-for-service provider and have been for years. And so we've actually done this multiple times. We did it as a modeling for DC, and then we also went back and reviewed it to make sure that it was accurate. And it's interesting how you've broken this down. We didn't do specifically pull out transportation, although we did hours. This to me will give you the data that we collect, which is how many, what does the hourly rate need to be for a DSP to break even, because we have to calculate out how many billable hours they work on a weekly basis, and how will they, and then you have to take into consideration absentee days and all of that, because you have to consider that as a part of that. I think Bernie did that with the CCSs a number of years ago using a very similar model to this, which I think turned out to be really effective for a specific ratio, coming up with a specific ratio. I don't know how that ties with the transportation piece added onto it, but I think there's a lot of data that you can gather from this formula, but I do think that it is incomplete. I would add some other components, including, you know, absent rate, that kind of thing. And we've done this formula. I'm happy to share the work that we've done and presented to the DC DDA and Health and Human Services in DC.
Yeah, I think that's those are great comments. That's very helpful information. I know for this specifically, we were looking at targeting the transportation component of the rate, which is why we had more specifically tailored this to transportation. But if that's information that's available and you know, something that can be shared, that's something that we would be interested in taking a look at. So within the, I don't know if there's, you know, other topics we want to kind of address here. Within the topic around COVID timelines and how data might appear at the moment relative to what the expectations are moving forward. Are there any thoughts around, you know, alternatives? For example, looking at timelines that are further back, or potentially postponing any changes to the transportation until such time that we can be a little bit more you know, comfortable in the data that will be available. So, you know, for example, maybe pushing this down the road 6 months, something like that, to see if that gives us a better picture. So just trying to see, you know, we're all kind of stuck between a rock and a hard place here. We want to move forward. We want to have things be data driven. We're also, we want things to be based on, you know, most recent information, but there are concerns about that recent information. So how do we move forward?
Yeah, and Chris, this is Maria. I guess maybe one other question: if you're going to use this data to help inform the BRIC component rate, you know, the other question that came to my mind is what policy rules and billing guidelines should we be using? So, you know, knowing that, you know, the LTSS and the new rate structure have different kind of rules around transportation. You know, is this more of a theoretical exercise of how transportation hours would look in a normal quote environment under the new LTSS system? So do you want actual data, or do you want estimates of what you know, what providers think would be incurred in a normal situation? I think that's the challenge with the COVID as well. It's just it's not a great. We know it's not normal.
Sure. Yeah, that's some great feedback. I think from a policy standpoint, that we did have some questions on, you know, how things were supposed to be billed exactly. There was some feedback around that, and so that's something you know, just received very recently. Haven't had a chance to fully digest and provide feedback around. But I think that is something that it sounds like additional clarification is needed around the policy side of things. When we're talking about data, I think our concern with using any projections is that's we're kind of essentially building a guess off of a guess. And so if we're asking for what providers expect it to look like in the future, I would, if I'm a provider and taking that information, I'm thinking that I would say, okay, well, what did things look like kind of when they were normal, and maybe what adjustments do I need to make to that? So I think what would be helpful to us is, if that's the case, asking what was normal, so to speak, and then how do we adjust that in a systematic way that's, you know, applicable to everyone. So I think in our view, it would make more sense to rely on experience, even if there are adjustments that are needed to be made to that experience.
Chris, to respond to your question, I think a couple of things. One, I'm not sure that we would be really comfortable with pushing this 6 months, given that this seems to be a key piece to addressing the DAHAB rates. And I think that, you know, I know obviously data is important, current data is important, but we are in an unusual time. And I think that other rate adjustments have been made using older data. I mean, we certainly know the, you know, the ledgers that are the, you know, were the initial core for all of this are very, very dated. And that, you know, there have been policy decisions that have informed changes and subsets of data that have informed and driven changes. So I guess I would just recommend that maybe we not have quite as high of a standard of, you know, kind of perfect current data when that hasn't been the standard for some other changes, and given that we are in such an unusual time with the pandemic.
Sure, yeah, I appreciate that. So based on what I'm hearing, I'm just gonna throw this out there, see if this makes sense. And you know, again, we're kind of processing things live, so we'll need a chance to discuss everything. But what would thoughts be from the RAG around potentially collecting data from, let's say, calendar year 19 or a similar period pre-COVID, asking about any adjustments that may be needed to account for changes from that data period to the projected period. So maybe from PCIS to LTSS, service definitions, those kinds of things. So asking for that data from prior to COVID, looking at what adjustments are needed, and then looking at how we could use that kind of adjusted data to inform any rate decisions. Does that sound like something that might be a best pragmatic approach given the constraints that we're facing?
I mean, I think that makes sense. I mean, I would defer to the providers on the call about whether they think they can pull that data. I mean, I would think you would want to look at maybe the first 2 quarters of FY20, which would not pull in weather problems and would, you know, would obviously be pre-COVID.
I agree. I think that might be a good strategy.
This is Karen Adams-Gilchrist. I agree with what you just said, Chris, and what Laura just said. I do have a concern that we do not typically, and I can only speak for my organization, we do not typically collect data this way, like small group, large group. We're not typically collecting the data that way because people's transportation isn't necessarily tied to the services that they're receiving. How they're coming in to us is not necessarily tied to that. So in collecting the data, it may not, there are going to have to be some assumptions that will be made, and you just probably need to be aware of that. And I don't know how many other providers collect data exactly this way, but there will be some assumptions in our ability to collect this data, if that makes sense.
Yeah, absolutely. I think that's a great point. I think that's one of the reasons that we had looked at, you know, maybe requesting more recent information because that might be easier to kind of process into this format. But if this is something that we're looking at, you know, maybe more historical data, then adjustments might be needed to how this is collected. So again, example here would be maybe not having this split by group size with regard to transportation, and just having one template for transportation. And then if possible, you know, having a separate section that is split by group size to look at staff ratios that are a pattern. But I know we kind of haven't touched on that yet. We're really just looking at the transportation, so we'll try to keep it focused there. If that is the case, yeah, again, throwing that out to the providers, is something like this, these 6 lines that we have here, is something like this information that we think providers would be able to provide pre-COVID? And If so, are there any other nuances that we need to consider? So for example, again, we're trying to work on this in real time a little bit, but you know, instead of having those 4 separate boxes, those 4 separate templates, putting it kind of all into one format, is that something that sounds reasonable to the group? Is that something that we think providers would be able to do? And what does it look like in terms of timeline for that information?
I really think it's going to have to be more defined if it's going to go out to providers, paid DSP hours transporting. So what is that referring specifically to? I just think for agencies as it's going to go to without having been involved in this process and the development of this, those numbers might be all over the place. Is it transporting people to and from in between once they get into services? I just think we need to make sure we have a key defining exactly what you're looking for them to pull. And like Karen said, it is going to take a lot, I'm assuming, for many providers to pull that because they do not collect the data as such in that way. I mean, Karen, would your agency, because you're on the call, but what are your feelings, or Scott, about just weekly average paid DSP hours transporting? What do you think providers are going to put in that category?
Well, I think you're right. Without a little more clarity on what is expected there, it'll be all over the place. For my organization, I think it will be easier for us to collect without group size, but we still would need a little more clarity on this particular piece to know exactly, if we're going to compare apples to apples, to know exactly what what the expectation is, what is to go in that block.
Right. I think we can do it. We just need to clarify so we make sure the data we're collecting is as uniform across the board as we can get it.
Right. And I think we could do pre-COVID, but the group size is the part that kind of throws me off on how we're going to collect that.
And this is Scott. We could probably come up with that, but several examples come to mind. We support somebody in employment who lives pretty far away. We're talking about when we go out and pick that person up and take them to their job and then come back. I mean, that's not rehabilitation. Are we including that? Are we including when we're helping people in some of the volunteer activities that they do? I do worry about the second bullet. We don't track hours. We weren't tracking hours at that time. You know, we have a daily rate, so we would have to be guessing that they were here for 5 hours, or was it 5.5, or was it 6 1/4? I mean, some of those would really change the bottom line. And that's, I don't know that anybody really has good service delivery hours at that point in time.
So I'm hearing we need clarification on exactly which services. You're using the term meaningful day, and when DDA uses the term meaningful day, they mean employment, day hab, and CDS. Are you just looking for day hab here, or are you looking for all three? So that's kind of my first question.
You know, everything here is kind of open to suggestions. I think our intent was to ask for all meaningful day services like you laid out there, because it may be misleading to only include day habilitation service time and compare that to transportation that might exist for everything, or maybe may not be reasonable to parse out transportation that only applies to day habilitation.
So the other thing I would suggest is, you know, how accurate do you want this data? I mean, it's that as you've heard the providers say, we don't track the data this way, but for most people who are doing both employment services and CDS, people have individual schedules. So we can actually pretty quickly do an estimation if we take a sample of 10 people and give you that kind of information. I think fewer people in day rehabilitation, as I understand, have individualized schedules, but you ought to be able to see pretty quickly in at least employment and CDS by just looking at a couple of schedules, so not in the rears. The other thing is so many services have changed since pre-COVID. Hopefully, we have become more of a community-based state than a center-based state. So I think looking at and as Donna said, that there's a lot more transportation being happening now than there was pre-COVID, because we are in the community more. So there's a lot more transportation, not just the beginning and the end of the day, but during the middle of the day as well. So I would think that if you wanted accurate data as of now, that to do a sampling of predictability using individual schedules, you ought to be able to get that pretty easily from providers.
Yeah, Karen, this is Greg. I agree with that. Where my head's kind of exploding a little bit is on line 5. Trying to think how there's going to be some rationalization of what exactly you apply into that line, with the cost, like, is it it's not like we have separate vehicles that are just tagged for certain people, right? We have an entire fleet of vehicles that get used. Some of them may have loans on them, some may not. That's just going to be, I just think that line is going to be really, really tough to get really good information on.
And this is Chris. I'd agree with Greg on that point as well too. It's going to be hard to do a sampling on the vehicle costs if we end up going in that direction. Chris, one question for you. Are you able to share, I guess, the logic or the game plan behind the request? We're gathering pretty specific pieces of data, or at least attempting to. What are the intentions with these pieces of data to help assist in reviewing the calculations for the transportation component? How do you take this and do your formula, and what is it you're actually looking for? Maybe there's a different way we can get to it.
Sure. Yeah, absolutely. So I think, originally in the ledgers, there was a relatively broad category of transportation costs that was compared against the wages, and that was used to develop a transportation component. We've heard feedback over the years from providers and stakeholders that information is kind of difficult to parse out specifically between what costs are considered transportation. And so what we were looking at here was kind of, I think maybe Karen had suggested a little bit, if we're looking at what amount of time are DSPs spending doing transportation versus providing a specific service. We were looking at in terms of hours, because we thought that may be easier, but if that's something that's easier with dollars, it'd be the same kind of information. How many dollars are they spending of wage time relative to transportation time relative to service time, as well as being able to split out any transportation costs that aren't related to wages, so that we could take a look at what those relativities are, the transportation hours versus total hours, and the transportation non-wage costs versus the total wages, potentially components there to see how that compares to the transportation component that was built in. So the theory here is to try to account for the costs that are attributable to transportation in a broad sense, both the time spent doing transportation as well as material costs of transportation. Account for that in the rates such that a wage is grossed up to account for those extra costs providers incur with regards to transportation.
Can I make a suggestion here? And this is like just a wild way of looking at this. So we are not a day hab provider. I know that this is based in day hab, and there's a reason for it, right? So a number of you on this call provide day hab services and you provide this transportation. How do you know that the current rate isn't sufficient? To me, that's the formula, right? You've got to know, if you're saying that it's not sufficient, you have to know why, right? Is it because it doesn't match your budget? Is it that it doesn't match your previous expenses? If we could figure that gap out, then the vector would tell you what is the data that we need to collect. So rather than starting with this data, we should start with the people who are saying it's not enough and say, why do you think it's not enough?
Well, just for clarification, I think the bigger issue is that the day hab rate as a whole is not adequate, and there have been a few items that have been focused on, and transportation's been one of them. So it's not necessarily that transportation's been the thing that's absolutely been honed in on, although certainly there has been some discussion about that, but I think it's one piece of the broader rate. I don't know if others want to jump in.
So could we separate transportation out as a separate cost? Would that be helpful? I mean, if this is a policy group looking at that, is that a policy that's better to make at this point than to have it embedded in a way that it becomes confusing? Should we separate the two issues out so that we have a transportation rate and then we have a service rate?
And just, this is Scott again. I appreciate that we're spending a lot of time on this because clearly it's important, but I want to go back to the point that Laura made, and that is, are the rehabilitation rates adequate? And we could spend a long time looking at this as the solution, but are there other ways to address the rehabilitation rates? And I just can't help but think about the fixed and variable cost assumptions. I don't know what you have as far as the agenda items, but I'm not sure we're going to get anywhere if we just stay on this topic.
Why don't we move forward to the next piece of the data request? But go ahead, Chris.
Yeah, I was just going to say those are some really good points. Karen, I think you hit exactly what we're trying to understand here. So the question that we're trying to understand is, if we're hearing feedback that whether a component or a rate specifically is insufficient, how do we know that? How do we make that determination? And how do we adjust for that? So one of the things that we had heard feedback on was transportation, which is why we were targeting that in that discussion. Another piece was looking at that fixed variable cost. And so there are a couple ways that we could kind of look at addressing that. So one way, using the current structure, would be to look at adjusting the staff ratios that are assumed, because that essentially divides out the costs proportionally. And so that doesn't necessarily tie, or doesn't explicitly tie direct, fixed costs and variable costs kind of to the individual level, but it may mitigate that issue while kind of continuing with DDA's intended original purpose here of trying to provide efficient care and incentivize efficient care that's appropriate for individuals. So we can talk a little bit more about the idea of the fixed and variable costs in a minute, but I guess this would be a good time to have a little bit of conversation here on the staffing ratio data request. What we had looked for was, basically how many individuals are being served in meaningful day services versus how many staff are providing those services. This is, relatively simplified template that we have here, and we understand that there are various nuances and complexities and questions around that. But this is the intent that we had here. We also had laid out this deliberately with those 4 structures of one-on-one, two-on-one, small group, and large group. understanding that that's not necessarily the structure in PCIS, but if it's possible to collect that information or aggregate that information in a structure that more closely mirrors the LTSS system, we would like to try to get as close as we can there. If we were to, for example, look at a general staffing ratio that includes people who have one-on-one or two-on-one level of need versus those who are in various large groups, our staffing ratio is going to be somewhere in the middle, and it won't necessarily be appropriate for any of those group sizes. That's why we had tried to parse this out into what we're looking forward on. But with that kind of context, just looking at this part of the data collection, are there any comments, questions, thoughts on looking at staff ratio information?
Chris, I'm sorry. I'm not sure I understand how the staff ratio data helps in light of the policy decisions that have already been made around definitions of small group, large group, CDS, et cetera.
Sure. So just for context and clarity here, what we're doing is essentially developing a rate using all the various components for the intended group size per those policy definitions, and then dividing it by an average number of individuals expected to be served. So for example here, if we were to talk about small group, we're looking at all of those costs, dividing them among 3 people on average, with the expectation that on average providers would tend to take care of 3 to 5 individuals in a day habilitation setting, understanding that there are occasions where there would be, 2 individuals or potentially even 1 individual that's served in that setting, but the incentive would be there to try to meet or exceed that 3 on average over the course of a year. So if that 3 assumption isn't necessarily appropriate anymore, then maybe it's that these group sizes are getting smaller, or potentially they're getting larger, or maybe there's some misunderstanding about how services should be grouped based on group size. So for example, if 2 to 5 is what was given as the policy for a small group size, maybe that should be changed to 2 to 4 or 2 to 7 or something along those lines. We're trying to kind of collect information to give us a better understanding of how staff ratios tend to exist for providers currently and how they would likely proceed in the future. Does that provide any additional information that's helpful?
It does. So you would be requesting this data divided by the small group and large group service definitions? Or would this be, I guess what's throwing me is I was thinking that this was, given that most providers are not in LTSS, that this would be across an entire service. And that seems like that would not be particularly helpful given the new service definitions.
Yeah, absolutely. So I think our intent here is to ask for this by those new service definitions, even if providers aren't in them yet. So if a provider is using the PCIS system, asking for how they are staffing and getting a better picture, of how they might serve various kind of groups of individuals. So essentially trying to get any information that may exist and put it into a format of what things would look like in the future. And maybe that's a complicated issue that we aren't able to capture, but that was kind of our intent behind that.
So I'll just make one last comment on this. I think that this also is affected by significantly by COVID and Appendix K, and people not being back in the severe workforce shortage. I think particularly for day hab, this would be difficult.
Yeah, I feel like it's a little bit unfortunate because it feels like it feels like we're pushing back, but we're not really pushing back because, you know, like we were talking with some folks the other day, like when you talk small group versus large group, well, if you have a large group, sort of by its very nature, you're going to have less difficult people that you're working with in that large group. But if you try to minimize your staffing ratio, you're not going to be taking people out into the community for a meaningful day if you have one staff person with 7 people. I mean, and so it like right now, my concern is that people are going to look at the existing rates and they're going to figure out where people go based on what they can afford versus trying to get the rates right for what people really need in this system. And I think that it's like the same thing with transportation. I feel like, you know, you're looking for some really good information. And I think, you know, those of us that are providers are like a little bit overwhelmed by the amount of stuff that we deal with in regards to transportation, trying to figure out how are we going to give you a number that's going to make any logical sense towards determining a rate based on insurance, leases, how many people use that vehicle, you know, where are they going, how far are they driving each day, what activities, to try to figure out all of those things across an entire system of thousands of people that actually kind of makes sense. And I think that's why it feels like we're kind of going around in circles a little bit, because it's like, what can we really, like what really good information can we give that's going to drive how these decisions are made? You know, Karen, you asked the question, how do people know the rates aren't enough? Well, they know they're not enough because a lot of them are less than what they were making before and they were losing money before. That's how they know. You know what I mean? But I don't know how exactly you quantify that. So I think for us, I mean, I think we all want to be able to provide as much data as is possible to inform really great decision making. But it feels like now we've already launched the airplane and now we're trying to figure out where the parts go, or if we have all the parts on board that we're even going to need the plane. And it's just hard for me to get my head around this entire conversation. And that's not a critique. It really isn't. It's just I'm trying to figure out, like, what could I provide for you guys that will help us, I guess, us collective really figure this out and make the most sense out of it. And I may be way off base, and if I am, I apologize.
And this is Scott. And Greg, I'm glad you said that, because it does feel like we're pushing back, which is not the intent. I'm looking at a chart here that says if I have a group of 5 people under PCIS, I would be earning $664 per day, and now if they're in the proposed rate, if I had them for all 6 hours, it'd be $534. Now I have to clarify a few numbers there, but the rate's lower. The rate is lower for groups, and that just, you know, we're going to lose money on that. You know, how do we get closer to what we're currently getting in rates?
I guess that's what I'm asking is to that question. I mean, when we, as the early adopters group, came back to you, Chris, and said your rates are wrong in the CDS, we said we took the rates and we said our average groups are between 1 and 2, and it's 1.27 is what you're funding. So we have to increase it to be at 1.2. You went back and you changed it, and you made that change. Don't providers know what an hour of service costs them? And I would go back to people who provide Dayhab and say, what does an hour of service cost you? That's exactly what we gave you as an early adopters group when we talked about CDS, and say, what does an hour of service cost you? And go from there and see where it fits into your profile the way that we did with the CDS rate.
Thanks. I think those are some really good comments. Again, Greg, I just want to say I understand exactly how you feel, and I appreciate you and Scott both saying, you know, it might feel like we're pushing back, and that's not the intent. But this is a very complicated topic. It's very difficult to try to get, you know, what's appropriate for all these thousands of people and these different situations. We're looking to have what information we can to try to best, you know, fit the program and be as appropriate as possible, while kind of, you know, hopefully incentivizing providers to be efficient, but also, you know, the intent isn't to say we're trying to, you know, run any providers out of business, anything like that. We're trying to figure out, you know, what are those costs? How can we best reflect them? So I guess to Karen's point, what we've shown so far is we've looked at transportation and we've looked at group sizes, but Karen kind of raised that question, what does an hour cost you as a provider? Is something that would be, you know, easier to collect that kind of information? Is that something we think providers would have? And then if we did collect that information, again, we're just kind of brainstorming here because we're all getting this feedback live and trying to respond live. We'll need some time to digest. But if we were trying to collect that information of, you know, how much does an hour cost you, how would we be able to use that information to move forward? So I guess I'll just throw those questions out to the group. Is that a question that we think providers would be able to answer? And, you know, how would we use that information in a meaningful way to make appropriate rate changes?
Chris, it's Chris. If we're going to take that approach of trying to determine cost per hour, which I think is going to be very difficult, what keeps popping into my head for transportation is, do we need to look at a cost per mile? You know, as a rural provider, much different challenges than a provider that's in the inner city. You know, staff time is up in both. You know, the distance traveled, the cost for the vehicle is different. Is there a way that we can accomplish what we're trying to accomplish by getting to a cost per mile? Most providers know how much or how many miles they travel in an annual year, how many people they've picked up, how many people they've dropped off, how many they've served.
This is Laura. I sort of feel like there's an argument to be made, though, Chris, about you know, a more updated look at what it costs per unit of service to provide the service. And not, I guess the question is, you know, you'd really have to look at, it's almost like looking at the ledger all over again. But I think one of the challenges with DayHab, and the reason it keeps coming up, is that I think it is a type of service where the issues with how the original ledger data was collected has just continued to kind of feed some problems with the rate development and continue to create challenges. So I'm mindful of, you know, how, you know, whether providers could provide the data. I would like to think we could. And I'm mindful of the timeline that would be involved. But having said all of that, I think if it was doable in a somewhat timely manner, that it could maybe address some of the challenges that we have been dealing with for several years.
This may be an unusual question. This is for Chris. Are you aware of any states that have gotten this right? And can we copy what they're doing?
That feels like a bit of a loaded question. There's anytime you're working with various stakeholders, there's always going to be some who are on board with certain things and not on board with various other things. So, you know, we can certainly look at what other states have and share some of that information. But I think, when we throw around those terms like getting it right, it's something we kind of aspire to, but there's, some issue with that. So we can certainly, look at what some of their options are and see what we can share there.
We'd be happy to share with you what we're doing in Pennsylvania because it's quite different. But I also, when you're launching a new, a whole new system, I understand you gotta, enter this thing on the ground floor with something that makes a whole lot of sense. But it just, this is a tough one. This is, if this was easy, you guys would have figured it out a long time ago.
Yeah, I think that's a great point. So we just kind of in the interest of time, I want to make sure that we're getting everything that we can here. It sounded like if you have some of that information about Pennsylvania that you think may be useful, we're happy to take a look at that as well. I know Jennifer had mentioned at the beginning of the call that we're looking at kind of the guidelines for how we can have communication that's appropriate within the confines of having the open meeting availability. We want to make sure everything is public and transparent and no one's getting any sidebar influence, that kind of thing. So I think there are some pieces of information that several of you have shared that we may want more information on. You're welcome to send things our way if you think that's helpful. And we may try to reach out to you just to get a better understanding of the information that you've shared or to clarify some of the requests or statements that you've made. But I think that's helpful, at least for now, in terms of making some revisions. I'll throw out that, we had, hopefully this doesn't put too much heartburn on my colleagues or anyone at the state, but we had, anticipated getting some feedback and sharing things at this meeting and having these discussions. If there is additional information that any of you would like to share that we didn't necessarily address yet here, or additional context that you'd like to provide, I would encourage you to share that information with DDA as soon as possible so that we can try to incorporate that moving forward. And again, we're trying to be as transparent with this process as possible. So any information that we get, we will make sure that we share with the entirety of the RRAG so that we're not, again, having any undue influence by certain individuals or anything like that. But again, in the interest of time, I'll just throw it out here for if there's any last things that in general around staffing ratios that you think may be useful to talk through right now. I'll give it another minute or two here to see if anyone has any other comments.
This is Scott, and go ahead, Maria.
Well, I was going to offer on the staffing ratios you had mentioned earlier around the fixed and variable, which I think is a challenge. Like we talk about transportation, the staffing ratio for transportation might be different than the staffing ratio for direct support services. And so in thinking about the fixed and variable, you had mentioned, maybe doing some sort of average or some sort of weighted average of considering that the staffing ratio might vary depending on what you're providing and when. And we had done some thinking based on our last conversation as well around fixed and variable, and we have some options as well that we're happy to present. In looking at at least day hab and large and group, or large and small group in particular, and how we might think about the fixed and variable, because I do think that's a key issue with when you start to look at where the gap in the rate is for at least for the day hab. And maybe we looked at day hab in particular, just knowing that we've got some deficiencies on that small group, and compared that to the current rates and what you're proposing, and are happy to share that if that that's appropriate to do now.
I would also suggest, Chris, something Karen Gilchrist said earlier is very true, that if you've never been ask to collect data in this way, having to go back and create it with a different eye than you have in the past is incredibly difficult, especially if you're thinking of pre-COVID, which is, you know, we're going to be saying PC for a long time, right? Pre-COVID. So I would say that if it, and especially since what I understood was that we wanted people to get into LTSS and then take a look at the impact. That was the purpose. I mean, we're looking at LTSS rates, so therefore that maybe at this point that you put this forward to people who've made the decision to go into LTSS and ask them to collect this data going forward so that we have a starting point. I think that convoluting PCIS2 data because we behave different because the requirements were different, and having them convolute them from 2 years ago is not going to give you what you really want. I think that using the current people who are in LTSS and providing these services is where to start, and you start them right now going forward and collect a month. Even a month is going to be better data than 2 years ago, a quarter data from 2 years ago.
Okay, yeah,
I want to
go ahead.
Reinforce what Maria said. And I don't know if you can give her 10 or 15 minutes, but you have a rate system, you know, you have the BRIC method figured out. I don't know that, you know, you have a lot of that, and some of the stuff that Maria has is using the current BRIC method and just looking at you know, where the fixed and variable, and if we could give her 10 minutes to show what she's come up with, I think it'd be valuable for the committee.
I would second that motion if we can.
Yeah, absolutely. I think that's useful. You know, again, I want to make sure that we're getting everybody's feedback and sticking as close as we can to timelines. But if that's something that I don't know if there's something that you wanted to share in terms of screen sharing, or if that's more discussion points that you wanted to present, Maria.
Yeah, I could screen share if I can. Somebody can walk me through how to do that. Are you able to give me? There's
Real
something I
quick,
need to
we're
do.
figuring out the logistics. Just want to defer to the chair, Jen. You're comfortable we're going in this direction?
So I think it would be helpful to have a little more context. What specifically were you planning to present on?
So we had looked at some options. I think the last rags we had talked about fixed and variable and some options there, and it's related to the staffing ratio and how we can kind of look at the staffing ratio maybe differently by the different BRIC components, or, you know, maintain the integrity of the BRIC but still recognize that there are different staffing ratios depending on which BRIC component we're talking about. So program support and transportation are two that I think merit you know, are problematic in the current BRIC methodology, and so we were thinking about different ways that we could recognize, you know, a different staffing ratio for those two BRIC components.
And Jen, it's Laura. We did share yesterday, and that Maria did have something to share that we had committed to doing following the last meeting, as Maria mentioned. I'm sorry, it doesn't sound like that word got to you, but we weren't trying to, you know, spring anything on you.
Got it. Okay, then why don't we go forward then?
Okay. Is there a way I can share screen?
Hi, this is Emily. I just stopped sharing.
Okay.
Are you able to see on your GoToWebinar little panel? Do you have a panel that shows where everybody's names and the question, where you could ask questions and see the handouts? Do you see that on your screen?
I can view everyone, but I can't see like a chat or anything.
Okay.
Are you trying to present?
She is, yeah.
Okay, let's make her a
Yes.
presenter. Let's do that. Donna, can you make her a presenter? Or do you want me to?
You can do it. Is it for Emily? Emily's presenter.
Maria.
No, it's Maria, D-O-M-I-N-I-A-K.
All right, Maria's now presenter.
Perfect. Can you see my screen?
Yes.
Yep.
Perfect. Great. Okay. So this this deck, as we mentioned, we wanted to address the fixed and variable rate components. And so, you know, as we've talked about in past meetings, that not all the costs should be divided equally by the number of participants in a group. So while the, you know, the cost of the staff, the wage, the ERE, the training, that's fixed, you know, that's your staffing ratio and really doesn't vary based on the size of the group, whether, you know, it's one person to three participants or one person to 7 participants, that we're calling fixed. But you do have other costs that are part of the BRIC development, like transportation, program support, that have a different staffing ratio. And they will vary based on the size of the group, and the costs do go up as the size of the group increases. It's not as if, you know, if you had a group of 10 people, you go and pick them all up at one point and transport them. You do have to, you know, they might have different transportation needs, from, you know, direct transportation to some sort of group transportation. So what we're trying to recognize is the variation of these staffing ratios within each of the different BRIC components. And so we
really quick, can I just interrupt you? This is Chris, just for a second. I just wanted to ask a question. Is this a deck that you'd be able to share with us after the call so that we'd have time to review? I just want to make sure that I'm focusing attention here properly, and want to see if this is something we should take notes on specifics here, or if this is a deck that you could share with us.
I defer to Laura, but yeah, I think the intention was we could send it later. Yeah.
Okay, perfect, thanks. Just wanted to clarify.
No, we appreciate having the time to go through this. We weren't sure, yeah, if there would be time on the agenda, but we did want to make sure that we talk through the options. So, so we came up with 2 options here. One is actually, option 1 is very similar to the approach that DDA had you know, presented, you know, a couple of years ago, and that was part of the rate methodology that was in the initial LTSS rates, that you know, basically splits the different components into those that are variable and those that are fixed. And then option 2 is just a different way of looking at it, you know, and it has a slightly different result. So we just modeled out those 2 options for your consideration. And as you mentioned, there's that third option of maybe, you know, doing a different staffing ratio, you know, that weights these 2 components. And, you know, this is illustrative. You know, we kind of focused on the components that we thought are those most variable, the program support and the transportation. I think there's, you know, some discussion obviously about what's fixed and what's variable, but, you know, for purposes of today, tried to keep the example simple, where we essentially, for option 1, add up all of the different components that we say go in the fixed bucket. So we just took your spreadsheet and just put all the different elements of the BRIC into the fixed bucket, or the variable component, you know, just put those together. So the fixed and the variable, when you add that together, is the cost of an hour, you know, in your model for these services. And then you apply the staffing ratios and the hours per unit, as you do in your model on the fixed component. For the variable component, you would just assume a ratio of 1, you know, to get to that cost of an hour. And then the last 2 columns, the billable rate per unit for the fixed plus the variable, results in your rate. So they're additive. So you're effectively just taking a portion of the brick and calling that variable and using a different staffing ratio than the fixed. Does that make sense?
Yeah, just so I understand, make sure that I'm not missing anything. Is the intent here, let's say if we're looking at rehabilitation small group, that providers would be reimbursed for the total of, it looks like 376 plus 356 every time, or is it that it would be 376 plus 356 per individual, or, you know, I just wanted to see if that's something that you clarify there.
Yeah, the rate would be the sum of the fixed and the variable billable rate per unit. So for day hab large group, it would be the sum of the 228 plus the 431 would become your new rate of 659. And we have the comparison later. So it's more just, you know, the other way to do it is just to say, well, let's assume 25% is variable and 75% is fixed, and you know, apply that that same ratio here. So we just tried to illustrate it, hopefully in a way that that made sense, but we can certainly, you know, share this later. The other option is, you know, if we have issues with, you know, explaining this to CMS or the BRIC model itself, another option is to adjust the percentage assumption that's in the BRIC for the group size for those costs that are variable. So basically taking your transportation percentage that's in your BRIC model, applying your staffing ratio of staff per unit to recalculate an adjusted percentage for transportation and in this example, program support, so that it recognizes that you know, we should have a higher transportation adjustment or a program support adjustment for some of those larger groups as another option. The key difference is based on how the other BRIC assumptions, notably the G&A and the service adjustment, because those are percentages of a rate, this actually ends up with a slightly higher result. And this slide shows how these two methods and options would change the BRIC unit, the billable rate per unit. So this is the 659 that we talked about in that previous slide. So it does, you know, obviously it has a pretty significant impact on your small and large group for the day hab in this example, and slight bump in the community, the CDS. And part of the challenge is Scott was mentioning earlier, you know, we did a rate comparison of the LTSS rate to the PCIS2, and there's a lot of numbers on this slide, but you know, I think to Karen's question around, okay, what is the difference? You know, what kind of gap are we trying to close? We've tried to, you know, figure that out as well, and I think this is the best that we've been able to do. We were hoping the Fiat tool would provide some similar, you know, information and insights as to what kind of gap we're looking at, but here we've laid out the hourly rates, and then if you have a 4, 5, or 6 hour day and you have very, you know, depending on the size of the group, PCIS2 has an acuity adjustment. So we've got kind of the high and the low, and, you know, for the high acuity folks, you know, those are pretty big negatives that we're looking at in comparison to where the funding is today. And then obviously if they're lower acuity, you know, there's some that are that are doing all right, you know, but it still requires a 6 hour day. So so that's where I think we're seeing, you know, we're seeing some pretty big gaps in between the current revenue and the new rates. So yeah, and then we ran these same numbers for the geo differential and the CDS. So the CDS looks reasonable. You you know, it's a nice, healthy increase, but on the day we're looking at some big negatives that is driving the concerns that we're hearing. So if I can figure out, that's what we had. If there's other comments or from the group.
This is Leslie. I have a question. For the PCIS2 rates that you're comparing to, is there any kind of adjustment for regional differences? Like, you know, we have the rest of state versus geographic for LTSS rates. Is there any kind of adjustment for the PCIS rates?
Currently, to my knowledge, no. So we, you know, we compared them to both the geodifferential and the, you know, the PCIS2 rates are the same in both charts. So we're comparing them to your, you know, to the geodifferential rates. So the gaps are not as high, but there's still some pretty big negatives.
Okay, thank you.
Mm-hmm.
If we're going to make decisions on this, I would really appreciate having a chance to look at this. It's just a very different way of looking at rates.
Yep, absolutely. Yeah, no, we're certainly happy to share that. This is a similar chart we had shared back in November, so we've just updated it with the new rate schedule that we're April 1. So should look familiar to some people. And I think I can stop sharing.
So I do want to make sure we have time for the rest of our agenda, but thank you for presenting that, and we'll certainly take that back and discuss it internally as we're kind of making decisions moving forward with this rate setting cycle. So I think, Chris, did you have a couple more points from your slides before we move on to finalizing our other priorities for analysis?
I'm sorry,
Sure.
This is me. It just looks like Donna, you might have to walk me through how to present again. I'm sorry.
I can be presenter.
Thank you.
So Maria, I just want to say appreciate that. We'll look forward to reviewing that in a little bit more detail. I think we also have the benefit of having had the opportunity to review some of the fiats. Hilltop is doing some analysis there and shared some information with us. So we're kind of collecting that information, and I think the intent is to share some of our initial findings and Hilltop initial findings from the fiat tools, in hopefully the next meeting or certainly in future meetings, so we can see how rate comparisons might look through different lenses. So the last piece here, for our perspective, we have looked at some kind of service versus definition kind of structures, and so we have looked at splitting out fixed and variable costs into separate rates, or breaking up services into maybe individual group size, where it's group size 2 versus a group size 3 versus a group size 4, or potentially having like separate rates that get billed. We've looked at a few various options of trying to account for the differences in fixed and variable costs, through a few options there. It looks like we have some additional reading to do based on what Maria has shared, and we can look at responding to that. But in terms of the initial looks with regards to addressing that by changing the structure of the rates, by adding additional services or splitting out services into various rates, I think that based on our discussion with DDA, that is not something that's feasible to start in fiscal year 23, but that we understand that is an issue and something that is being addressed with the RRAG and reviewed, again, like that information Maria shared, we've heard Chris Parks had some, concerns about how that works with transportation and different providers and how that can be divided out appropriately. So our intent here is just to kind of give you an update that in terms of doing any rate structural changes on how things would be billed to address that, that's not something that would be in place for fiscal year 23, but the concept of looking at the fixed and variable costs and how that may be addressed is something we want to continue to review and discuss.
And Chris, can you say why, can you help us understand why that wouldn't be an option for fiscal 23? Because it's more the math. It doesn't, it's less about the data. I understand it'll take a while to get the data to get the, to review that transportation component, but the methodology feels like something that could get done by fiscal 23 or in time. So can you just share the thinking behind why it's not possible for fiscal 23?
Sure. So the options that we had seen so far that had been shared from the provider community looked like there were, some mathematical issues where there was cost duplication, and in order to better address that, there would need to be a split of how the services are defined and billed, and so that is something that it wasn't necessarily a math exercise so much as an operational exercise of, does small group need to be split into individual services, or does day habilitation need to be split into two rates, one for fixed costs and one for variable costs, and things like that. And so there's a timeline of implementing that and availability there. So I'm not sure if anyone from DDA is able to speak a little bit more to that, but I think from our perspective, the way to address it from any processes that we've seen so far would be through more structural changes, which didn't look like that would be possible within the time frame.
Okay. Yeah, because I think the options we were sharing wouldn't require any structural changes. So that makes sense if you do have policy and structural changes, but if you could work within the framework, is it on the table as an option to implement? I think the concern is obviously, the day hab and the underfunding there. So you don't want to continue that.
Yeah, absolutely. We'll review information you shared and see if we can provide some responses to that.
Can I ask a question about, I don't know who's in the second round of the LTSS group, but I know that there's a lot of people who raise their hands to go into LTSS. Are any of them day hab? And if they were really concerned about their rates, would they have gone into it? That would be really interesting for me to know what that vector is for people, and maybe, I don't know, maybe day hab people who provide large day habs made the choice to not go into LTSS.
Well, I can tell you, we talked to people who chose to go in, and they felt that the upside of the residential rates were enough to counter losses in day hab. So they made that decision, but knowing that the day hab rates were problematic. And so for day only providers, or providers with, there were some providers that chose not to put day hab in and only residential, but some chose to do all of it. And the ones that I talked to said that they thought the residential bump was worth, in their case, the loss. But we don't, I think we don't want to have any one service be dependent.
Right, of course.
Be dependent on. And I would just say, I would be remiss if I didn't say, I think, we feel really strongly that to just say blanket the no change for FY23 is troubling. I mean, we would like to see there, try to find some way to make some movement on this at some point.
This is Leslie. I just wanted to clarify the no change for fiscal year 23 is just referring to the example solution or a review that we talked about last time, which is taking, for instance, small group and splitting the service into group size 1, 2, 3, 4, and 5 and having discrete services. So the no change is just talking about changing the service definitions, changing the way that the services are being operationalized, because we've heard that it could be administratively burdensome. We don't have enough time to change the system. So that's the only thing that this no change is referring to. We're still visiting the other pieces that we've talked about. So just clarifying there.
That's helpful. Thanks, Leslie.
Absolutely.
All right, so since we've had a lot of really good discussion about DayHab, I think we will now move forward to finalizing the other, or I guess taking the next step towards finalizing the other priorities that we want to make sure we analyze in this cycle. So I will turn it back over to Leslie.
Thanks, Jennifer. So just like Jennifer just said, on screen is the list of priorities that we've been sharing in all of our meetings. We want to narrow down what we're looking to address in fiscal year 24. We're still looking at the dehabilitation issue, but looking forward, we want to start focusing on how we're going to move forward with the fiscal 24 rates. We've listed the topics highlighted in yellow that we think we're able to address in this next year as a starting point, but we wanted to open this up for discussion. And so these are not set, but these are just a starting point for our discussion here. The couple of things that we've talked about is clarifying the cost and responsibility for transportation in the rates, because we are continually and consistently hearing that this is a major issue. We want to talk about comparing the expected revenue and expenses for each of the group homes sizes, and then reviewing if rates are appropriately addressing the needs among members, and this is the acuity issue that we've also consistently heard feedback on. Keeping in mind that we understand all of these are priorities, which is why they've been listed, but some items will take longer because of data collection or the review process, and so that does determine how much we can address in the upcoming rate cycle. But I just wanted to open up at this time. Do you think we're on track with these priorities that we've chosen? Are there additional ones or different priorities that you would like to focus on rather than the 3 that have been highlighted?
I'm going to step in right away and say I don't see on here anything about career pathways. We have a tremendous issue you have in here, explore relationship between wages and staff turnover. However, I think what data shows us from our colleagues that have studied this exclusively is the issue is not related to wages and staff turnover, it's career pathways. The 3 primary career supports around recruitment and retention, and I don't see that on here, and I don't know that you can address any of these without addressing career pathways first.
That's helpful. I'm just taking notes to make sure I get what you just said. Are there any other additional comments?
Leslie, this is Karen Adams-Gilchrist, and based on the previous conversation about the DayHab rates, I just want to be clear: is the DayHab rates and that we know are inadequate continues to be a priority. Should that be on this list, or is it a priority right now?
So the process that we've just outlined with the data collection template, we're looking to collect that data as soon as possible so that we can be reviewing that ahead of the fiscal year 23 and potentially fiscal year 24 rates. These are additional priorities that we would like to focus on in the upcoming rate cycle beyond just the dehabilitation.
Okay, so the DayHab stays on there. This is beyond the DayHab concerns.
Correct.
Thank you.
And sorry, the intention of this is that we already have a plan or we're working on a plan moving forward to address day habilitation, we're now trying to identify additional priorities to start thinking about how we're going to address them in time for fiscal year 24.
Leslie, a couple questions.
Go ahead, Laura.
I had a question and a comment. So under rate construct, it says it lists the fixed and variable cost allocation. And I guess similar to Karen's question, is that going to be considered as part of the DAHAB discussion that's happening sooner than the FY24 priorities, or is this an indication that's off the table?
From my understanding, and DDA or the rest of the Optimist team, please feel free to jump in, but it seems like the dehabilitation rates and fixed versus variable costs are very much intertwined in our conversations we've been having. So I would imagine that it would be being addressed through the DAHAB rates.
Yeah, I would just, this is Chris, I would echo that sentiment. You know, it sounds like that's been something that, you know, maybe fundamental to dehabilitation rates. And so based on that feedback, I think we're planning to discuss that in the next meeting.
Okay. I would say that, I just want to add, and thanks for that, Chris. The two things that jump out at me are looking at the issue of wages and staff turnover, and I would add the other pieces, minimum wage as a factor in that as well. We have a county, Howard County, where they are raising the minimum wage actually to be higher than the state minimum wage. So I feel like the wage component is important. You know, I wouldn't want to see us really wait until FY25. And then the other piece is there is a lot of, I get a ton of emails and concern about the status of employment rates. So those are kind of the two that jump out at me.
Thank you for that. And so I just want to circle back. We've heard from two people now, Laura and Karen, saying that they think the wages and staff turnover, or as Karen had put it, career pathways, is a very high priority. Is that something that we should look at for fiscal year 24 instead of any of the three that are currently highlighted? Unfortunately, with the time constraints and the constraints of collecting data, we won't be able to address all of the issues. But if we can prioritize specific issues, we can start to tackle them one by one. And so if we are going to look at wages and staff turnover, what other priority would we have to push to the next cycle?
Didn't the revenue and expenses for group home size, didn't that get taken care of when the dialogue about when dedicated hours happened? Didn't that already take care of everybody's question around that?
We've heard some additional feedback around group home sizes, but if that is the consensus, then we can strike that as a review point for fiscal year 24, maybe push it to fiscal year 25, and then look at the wages and staff turnover issue instead.
I mean, I would just say, I think DSP is, you know, however you look at it, wages, career pathways, I mean, it's all critical. I mean, given that it is, for most providers, the #1 challenge, I think it has to be a priority. And I think I would probably agree that it would, if I had to push something, I guess I would push the, you know, revenue and expense around group home size. But I would say I still think employment is really critical, and I'm not sure what you would take off, but you know, we're an employment first state, and you know, providers are feeling a lot of pressure around and concern around whether they'll be able to continue to provide employment supports.
I want to hop in and just agree with exactly what Laura just said. And Karen also, career ladders, career pathways, and the relationship between that and wages and turnover. There is clear data, and we have it at Penmar that shows the difference in retention when people have a career path. And that is the driving issue that all of us are facing right now. So, you know, all of these other things are very, very important. But if we don't have a workforce, we don't have, you know, we don't have a mission as an organization for us to carry out. And also, I think that we do want to laser in on employment. And I think that we're going to probably have the opportunity to look at data fairly quickly, because Maryland is an employment first state, and employment providers are not faring well under LTSS. So I would agree that those should be two of our highest priorities.
Thank you
This is
for all
Scott,
the.
and Leslie.
Go ahead.
Leslie, I appreciate you trying to narrow the list down, but I have to speak up a little bit about the non-billable time, and it applies to employment rates. And if you send a job coach out to provide some direct job coaching, and they travel 40 minutes to the job, and they're on the job for 25 minutes that they can bill for, your billable time doesn't cover your expenses. So they're linked together, that billable time with employment. It links with personal supports. You know, right now I'm supporting a woman that lives 35 minutes away and wants an hour and a half of service. We have to provide it, but I send the staff down there. I don't cover direct costs. So I think they're linked in there as well.
And I would add, I think, you know, you've asked for the data for transportation, but you also had a line item that said non-billable staff time. So, you know, for meaningful day. So some of these pieces, if you thought about your the data requests that you're trying to get done, you know, more immediately for transportation, it could be expanded. I think because you would be collecting then new wage information, some non-billable staff time. To help inform, you know, some of these other rates as well.
Yeah, absolutely. I think that was going to be my follow-up comment too, is it seems like some of these issues are intertwined. And so in addressing some priorities such as like transportation, we may be addressing or alleviating a little bit of the non-billable time concerns. But we won't know that until we have the data or until we can start the process of focusing on these issues. And so just circling back, I'm hearing that the DSP wage concern is a very high priority for this group. And so we can take that back internally and discuss how, if this is something that we're able to address in the upcoming year, and start talking about the process by which we can address that issue.
I just think utilization, as you know, sitting by itself is a massive issue in this new system, and how quickly we can really compare what we're seeing across the state versus the assumptions that were made in creating the rates in the system. I know that's going to be data that's going to be real-time data that's going to be hard to really have a lot of information on quickly. But I do think that that's something that is we will be talking about that as a group, I'm sure. And so, the faster that we can focus in on really looking at even the first few months of transition and utilization and what that looks like, and, what percentage of what was expected is actually happening, I think that's going to give us some really good information for what we want to be looking at in the future as well.
Hey, Greg, this is Chris Welch. Just asking a clarified question there.
Yeah.
Are you talking about that in regards to aggregate utilization, like how it would impact the provider? Or is that more of a utilization kind of mix issue, or the way that you're delivering those services has changed? I'm just.
I think I don't want to give a smart answer and say yes, but but really, yeah, it's all of those things. But I think that each of us as providers have concerns about our ability. You know, rates are great if you can bill for them and capture them. And with the you know, the number one issue that all of us are dealing with in terms of workforce, you know, you can run projections and projections go out the window when 10 people, you know, don't show up for work. So I'm just saying that I think within the system, I think it's going to be an issue for all of us internally in our own organizations that we're going to have to figure out how to manage effectively as best we can. But I think it's going to have a huge effect on the overall system, because I wouldn't be surprised if you get a quarter into this and you go, you know, there's a lot of services that are in the system that nobody's been able to bill for, nobody's been able to capture revenue for. And, you know, you don't want to get too far down the road here with a lot of unspent money, you know, in this system, because bad things have happened when that's happened in the past as well. So I just think it's something that we want to be focused on and looking at as quickly as we can as that data becomes available.
Okay, yeah, thanks for that clarification.
Does that make sense?
Yeah, absolutely.
Okay.
I think that makes a lot of sense, and I think that's something that we're intending to discuss in just a minute on another slide. Yeah, just wanted to get that clarification. I'll turn it back over to Leslie.
Yeah, thank you so much. All these comments have been extremely helpful, and we'll take the points that were brought up about the various priorities and discuss internally prior to the next meeting. Just in the interest of time. Oh, go ahead.
Quick thing. So when we talk about career pathways, we're talking about everybody in organizations, including some of the new services, and it encompasses the employment first, right? Because we have people who have to be credentialed basically as DSP3s with their national accreditations, and also new services like the housing support. So they're all a part of the career pathway. They're not, it's not just DSPs, it's the entire career pathway of people who work in our system.
Yes, thank you for that clarification. I had misspoke. So yes, we'll be looking at wages and staffing as a priority. So in the interest of time, we'll move on to the next slide, which is this talking about looking forward and how we're going to be collecting data. We had been talking about the cost report template with the intention of aligning it and consolidating the general ledgers so that we can have just one form where we get all of the information. We've heard feedback that there needs to be enough lead time so that we can share the template through which the data will be collected, so that providers can plan and start collecting data that way. The current plan is to keep the cost reports with some small modifications and begin collecting that in the next calendar year, fiscal year. For rebasing, because of the lead time needed and the labor intensity of collecting this information to use for rate setting, we'll be looking at collecting general ledgers for this first rebasing cycle, looking at the time period of fiscal year 22. And we're still working through the process by which the general ledgers will be shared and collected and the conversations that need to happen, but that information will be forthcoming. We just wanted to update you on where the current thinking is, and nothing is set in stone yet. Any questions or comments on that?
Only that you will have some data already, because both personal supports and supported living in the cost reports that were just due have been in existence. So I think it's important to look at the impact using those two specific services, which were in LTSS for 9 months, right? 8 months.
Yes, and we plan on using, we're data people, so we plan on collecting and using as much information as we possibly can. But just updating you on the methods by which we're collecting that data.
Leslie, it's Chris. Can you clarify what you mean by small changes to the cost report?
That is currently under discussion. I don't want to come out and say that there's going to be no changes to the cost report. There are changes. If there's potential changes to the cost report based on the information that the state will be collecting, or the cost reports could be the same. I know that's a very roundabout and confusing way of answering that question, but essentially the general formatting of the cost report will be consistent, and we're still talking through what changes or if there will be any changes to them.
Thank you. Again, I'll just say again, if there are any changes where we're asking for additional data that we've not previously collected in that template, the cost report template, that information needs to go to providers before the start of the fiscal year, so that they need to make any structural changes in their general ledger, they can do so now, not at the end of the year.
Absolutely, and that's the big reasoning why we're choosing to not go forward with consolidating the cost reports in the general ledgers right now, because that's a very big lift for both providers and for collecting that data. And so there's going to be no major changes, as far as I know, to the cost reports. And we intend to share that as soon as possible. If there are any other comments on that, I'm going to turn it over to Robert to talk about the supplemental budget.
This is Chris. I'm not sure, Robert, if you're talking yet, but I don't think we're able to hear you yet.
How about now? Can you all hear me? Okay, great.
Yep.
Thank you for that. I always have issues with the headset for some reason when we're using GoToMeeting. And I'm a tech savvy guy, so I don't know what the issue is. But first and foremost, we want to thank those of you who have advocated in partnership with the Maryland Department of Health, as well as the provider community, for the passage of the governor's supplemental budget. The supplemental budget, as you know, adds an additional 4% rate increase and will positively impact all DDA providers equitably, as it will follow the same approach as the mandated annual COLA. The rate increases for FY23 will be effective July 1, 2022 in both systems. So this is an across the board increase. And when you obviously add that to the 4% COLA, the rates will increase by 8%. If the in-process rate work that we discussed today identifies the need for rate increases beyond the FY23 budget, you have our continued commitment that this will inform this administration's FY24 budget development. As the rate review work progresses, there are a number of factors that obviously will be carefully considered. But again, we want to thank you for continuing the important rate work on DAHAB. As we've shared before, it is in our collective interest to stay focused given the timeline for the FY24 budget requests. Are there any questions? Okay, hearing none, I'm going to turn it over to Jennifer to discuss next steps and to close this out.
All right, thanks, Robert. So thank you everyone for all the discussion today. I know we really appreciate all of your good questions and your insights. Our next meeting will be Friday, May 20th at 12:30 p.m. And major topics will be following up on data collection, discussing cost reports more, more detailed discussion about how we're going to approach some of these FY24 priorities we were just talking about, and review of preliminary CIAT analysis findings. Members of the public who would like to observe the meeting can register through the DDA training calendar at Constant Contact event. When you register once, you get reminders for each meeting through GoToMeeting. And meeting connection links will be sent 1 day and 1 hour prior to the meeting. The meeting minutes will also be made available following the meeting. If you have any questions or would like to request accommodations, contact Donna Will at donna.will@maryland.gov. And for our next slide, here is a broader look at our upcoming meeting dates. On Friday, May 20th at 12:30 p.m., Friday, June 17th, Friday, July 15th, and Friday, August 19th. Go to the next slide. All right. All meeting materials are available through a designated DDA webpage for this advisory group, which you can see up on the screen. And thank you all again for attending and for your participation. And we look forward to continuing the discussion on May 20th.